Hello students, the next topic that we learn today is hemolytic anemia. So what is hemolytic anemia? So in this what happens is the red blood cells, when you look at the membranes of it, it is defective. It is not formed appropriately. The cells are of different morphology and it is fragmented. Fragments means what? It's in pieces. So what happens? The red blood cells breaks very quickly. So that kind of a condition is called as hemolytic. Now another way to remember this is when you say lytic or lysis means what? It's breaking or breaking down into fragments. So when such a condition occurs, then you know that yes, this is called as hemolytic anemia, because what happens here, the red blood cells gets fragmented. Now, meaning for this is hemolytic anemia is characterized by the increased red cell destruction and decreased red cell lifespan. So what happens is, yes, though the red cells are formed, again the lifespan is very short. So how long they survive is very short. So when you look at this picture here, this is what a normal red cell looks like. Again, when you see this here, it is sphere shaped again in hemolysis, so eventually it is leading to rupture. So it is like a small disc when you look at the healthy red blood cells, the nice red round shape, and it's like a disc. But again, eventually when it is heading towards this condition, you will see that it becomes sphere shaped and eventually it starts to rupture, and this increases the content into the blood plasma. Okay, so as it ruptures, again these fragments are increased into the blood plasma. So this condition is called as hemolysis. Could be, yes, any sort of infections, heavy use of antibiotics when a person is on antibiotics for some reason, that he's got an infection, blood cancers, and as we mentioned in the previous condition, autoimmune disorders. That is one of the main important causative factor for this, because when your body is kind of destroying your own healthy cells, and that is also relating to this particular condition, certain type of tumors, even when there is your spleen is not functioning effectively, and mechanical heart valves. Okay, so that can also cause damage to the red blood cells, and also when there is a severe reaction to any sort of blood transfusion. So mechanical heart valves, as we do, I hope you remember what we have learned in that valvular disease or disorders that we have learned. So even those mechanical heart valves, when you implant them, yes, the other common ecological factors will include, yes, as we told you, the spleen may not be functioning effectively. It could be enlarged, infections, leukemia. Again, all these are blood disorders. Infections could include, yes, typhoid fever, Epstein-Barr virus attacks, tumors, and SLE, which is nothing but an autoimmune disorder, which is nothing but your body is attacking the healthy cells. And again, SLE is pretty serious because it can affect anywhere in the body. It can be your brain, your heart, your muscle, your joints, your skin, the blood, everywhere. So again, we do not have a particular cure for this particular condition. So autoimmune disorders are very critical or crucial when it comes to this particular disorder. And HELP syndrome, which is nothing but hemolysis, elevated liver enzymes, and low platelet count. So low levels of platelets. So that is nothing but HELP, HELLP syndrome, which means you have all these characteristics. Stand for hemolysis, which we see now that yes, there is breakage of the blood cells. Elevated, when the liver enzymes are elevated, when you do the test, you will know that the enzyme levels are elevated, and there is a low level of platelets. So these are all to this particular condition. Now the clinical manifestations for this, yes, the person will be feeling excessively, will look pale, fatigue, fever, confusion, lightheadedness, dizziness, and also weakness in order to perform his physical activity. And the other signs will also include that is the yellowing of the skin, and even the urine can be really dark. Heart murmurs, when you listen to the heart, yes, you can feel that abnormal sounds, increased heart rate, as well as enlarged spleen. How do we diagnose this particular condition? Yes, a thorough physical examination, health history collection, complete blood count. Other blood tests can also be done, urine tests, bone marrow aspiration, or biopsy as well. It's just because we know that all this is related to your blood cells. Yes, even if you don't find anything else, just by taking the sample of blood, yes, a deeper investigation will include the biopsy, where you're taking a sample of the bone marrow, and that is actually a sterile procedure. So you do the result. Now, diagnosis again will include looking at your levels, like your hemoglobin levels, your bilirubin levels, and also making sure that your liver functions are also appropriate, and all these tests will actually tell you if there's any kind of fall in the levels of the blood cells. The management, again, yes, when you know it is a autoimmune disorder, yes, or you'll be kind of giving in, or you'll be replacing that lost kind of volume. So again, it'll be blood cell transfusion. Also, it includes immunosuppressants therapy, again, which will include such as steroid therapy. So again, with that, your body is able to recover faster. So when it is an emergency, yes, we have to do that, and if not, followed by surgery. And also this will include a first stem cell transplant as well. And even when you say surgery, again, it could, as we told you, yes, when your spleen is enlarged, so again, it involves a surgery of the spleen, like splenectomy can be done, blood transfusions, as I told you, corticosteroids, and also administration of iron, folate, as well as erythropoietin. So all this is kind of managing the low levels of the hormones. And the preventive measures for this will be, yes, staying away from people who are sick, avoiding large crowds, washing hands, taking care of hygiene, avoiding undercooked food. Means what it means is you need to cook your food thoroughly. Okay, undercooked means not cooked properly. And also taking care of your oral hygiene, brushing your teeth, taking care of these simple measures at home, and also avoiding this flu condition that is really bad. And with this, we finish the topic, hemolytic anemia. I shall see you in my next session. Until then, thank you for your time.